Okay, infection control. So we are talking about infection control, which is one of the most important subjects. Once you graduate, all of them are dentists, right?
Yeah, dentist and medical.
All right. So medical or dental, infection control, everybody will have to do, because there are legal obligations for you as a dentist or doctor to do infection control properly. Otherwise, the regulatory authorities can actually take you to court.
Infeksiya kontrol juda muhim fan hisoblanadi. Sababi sizlar tibbiyot o'qiysizlarmi, ya'ni sizlar meditsinada o'qiysizlarmi, biologik fakultetida o'qiysizlarmi, infeksiya kontrol bilan sizlar har doim, har kuni yuzma-yuz keladigan sohalar hisoblanadi. Agar infeksiya kontrolni bilmaydigan bo'lsangiz, sizlarga nisbatan demak jinoiy ish ochilishiga ham sabab bo'lishi mumkin.
And not only that, you have an obligation, because you as a dentist or doctor, if you don't do proper infection control, will carry infections to your family and they will get infected. You know, the COVID-19 is a good example. Some COVID-19, some families died because the doctor brought the infection from the hospital to the home. So this is one example. So this is very critical area you have to study, not because you have to study, but because it is very important for your lifetime.
Bu aslida mas'uliyatiga COVID-19 paytida shuni ko'rsatdiki, doktorlar bemor bilan gospitalda kontaktda bo'lgan va ushbu infeksiyani ularning oilalariga olib kelishgan. Bu juda muhim hisoblanadi. Sizlar nafaqat o'rganishingiz uchun, balki hayotida bo'ladigan soha hisoblanadi.
So this shows over the last so many years, we have got new infections coming. Okay, they are called emerging and re-emerging infections. So they are predicting the next big pandemic in 10 years time from 2022. So that's in 32. Every 10 to 15 years we get pandemics. So hopefully we will not get it. But so this is just an example of why we have to keep on studying this subject.
Oxirgi vaqtda juda ham ko'p pandemiyalar uchramoqda. Tarixiy aytadigan bo'lsak, pandemiyalar har 10-15 yilda demak uchrashi kuzatilgan.
So this is a world map of new infections and re-emerging infections. You can't see it here, but there are so many happening all over the world. For example, there is a thing called Mpox, monkeypox. Mpox is called in Africa. And yesterday I saw a news item where you get one virus infection, Hantan virus infection, infected patients took a plane from US to UK. So they are very worried that it will go to UK.
Hozirda ushbu slaydda sizlar ko'rishingiz mumkin, jahon kartasida juda ham ko'plab pandemiyalar uchramoqda. Xususan Mpox infeksiyasi Afrikada uchradi yoki boshqa infeksiya oxirgi yillarda Angliya hukumati tomonidan ushbu infeksiyani nazorat qilish bo'yicha juda ham qattiq choralar ko'rilgani aytilgan.
So this is a book I just donated to your library, and I'm sure you will come across this. Hopefully you will get a translation into Uzbek or soon.
Bu meni muallifimdagi kitobim. O'ylaymanki yaqinda o'zbek tiliga ham tarjimasi chiqadi.
So why do you want to do infection control? As I said, you are exposed to the infections every day, right? And then there are regulators who are looking at your infection control procedures, which is very important. Otherwise, they can take you to the court. And you have to be care. There is a thing called the duty of care. You have to have patient safety in mind, because if you don't do proper infection control, you will infect the patient. And then there is another important area which I don't have time to go in. It's about antimicrobial resistance.
Nima uchun infeksion kontrol juda muhim hisoblanadi? Birinchidan, infeksion kontrolni to'g'ri amalga oshirmaslik bu patogen mikroorganizmlarning nazoratdan chiqishiga olib kelishi mumkin. Bundan tashqari atrof muhitga katta zarar beradi. undan tashqari infeksion kontrolni to'g'ri amalga oshirmaslik huquqiy nuqtai nazardan katta muammolarga sabab bo'lishi mumkin va bemorlarni xavfsizligi, undan tashqari antimikrob vositalarni demak rezistentligini ham nazorat qilishimiz juda muhim hisoblanadi.
So because it's a long lecture, I'm skipping some slides. But the important thing to understand is that this is the cycle of infection. You have the patient coming into your clinic, it's transmitted through the air or through cuts and so on, and then through bleeding, and then you transfer it to your other patients or to nurses, and the cycle goes on.
Demak, shu slaydda infeksiyani tarqalish zanjirini ko'rishingiz mumkin. Demak, qanday hammasi boshlanadi? Patogen mikroorganizmlar birinchi bo'lib, demak, bemor bilan birgalikda klinikaga keladi va siz og'iz bo'shlig'ini, demak, nazorat, demak, og'iz bo'shlig'ida amaliy ishlar amalga oshirayotganingizda, demak, ushbu infeksiyalar, demak, qon yoki so'lak bilan birgalikda sizga o'tishi va klinikada patogen mikroorganizmlarning tarqalishiga sabab bo'lishi mumkin.
So the infection control guidelines have started in 2003 or even before that, and it has evolved due to the new infections like COVID and bird flu and all these things. So the important thing is, so you can see the line here, but the important thing is you have to be aware of the new developments all the time.
Infeksion kontrol bo'yicha birinchi qo'llanma 2003-yili ishlab chiqilgan va har yili bir necha yillardan keyin demak ushbu protokol demak o'zgarib bormoqda. Lekin insoniyat shunga tayyor bo'lishi kerakki, yangi patogen mikroorganizmlar uchun, ya'ni yangi qo'llanma ishlab chiqishga har doim tayyor bo'lishimiz kerak. Ya'ni biz buni o'zimiz nazorat qila olmaymiz.
So the first infection control guidelines which were adopted all over the world was done by the Center for Disease Control in USA, CDC USA. But now the World Health Organization and also adopted the same CDC guidelines, and it's regulated throughout the world, including your country.
Birinchi infeksion kontrol bo'yicha qo'llanma 2003-yili CDC degan kompaniya tomonidan, Amerika infeksiyani nazorat qilish kompaniyasi tomonidan ishlab chiqilgan. Lekin hozirda infeksion kontrolni ishlab chiqish bo'yicha qo'llanma Jahon Sog'liqni saqlash tashkiloti tomonidan amalga oshirilmoqda.
So the basic infection control you do in the clinic is called standard precautions, right? And it has 5 key areas: hand hygiene, appropriate wear of the personal equipment, safe injection, instrument sterilization, and surface disinfection.
Infeksiyani nazorat qilish bo'yicha standartlarni aytadigan bo'lsak, bular 5 ta deb asosiy nuqtalarni aytib o'tsak bo'ladi. Birinchisi qo'llarni gigiyenasi, ikkinchisi maxsus saqlovchi vositalar, undan tashqari inyeksiya qiluvchi vositalarni xavfsizligini ta'minlash, undan tashqari instrumentni sterilizatsiya qilish va o'sha poverxneslarni dezinfeksiya qilish 5-chi soha hisoblanadi.
So let's talk about each of these now. Okay. Number 1, hand hygiene. These are the most important carriers of disease. The hands are the most important carriers of disease. So you have to be particularly careful about hand hygiene. And so what do we do? So you must be thinking as first year students, you wash the hands all the time, right? No, now, okay, you can wash the hands, but the basic premise now is alcohol-based hand rubs. If the hands are not dirty with saliva or blood, then you can use alcohol-based hand rubs. Don't have to wash it all the time.
Birinchi juda muhim soha bu qo'llarning gigiyenasi hisoblanadi. Sizlar shuni bilishingiz kerakki, qo'llar patogen mikroorganizmlarni tashuvchi asosiy vosita hisoblanadi va qo'llarni gigiyena qilish juda muhim hisoblanadi. hozirda sizlar birinchi kursida sizlar o'ylashingiz mumkin, qo'llarni har doim biz yuvib turishimiz kerak deb o'ylashingiz mumkin. Lekin aslida oxirgi ilmiy ma'lumotlarga ko'ra, alkogol saqlovchi vositalar yordamida qo'lingizga surtadigan bo'lsak, bu patogen mikroorganizmlarni demak eliminatsiya qilishiga olib keladi. Ya'ni siz qo'lingizni har doim ham demak yuvishingiz shart emas agar alkogol saqlovchi vositalardan foydalangan bo'lsangiz.
I don't know whether you have been taught how to wash your hands.
Sizlar qo'linglarni yuvish bo'yicha o'rgatishganmi sizlarga qanaqa qo'lni to'g'ri yuvish kerak?
Yeah. Can somebody demonstrate it for me?
Kimdir ko'rsata oladimi qo'lni qanaqa to'g'ri yuvish kerak?
Probably not, right? Yeah, so I don't want, it's okay, I don't want to embarrass you. So there are like 5 movements called WHO. So it's rubbing like this. Make sure that every area is washed properly. You know, washing the tips, right? Washing the glove, the webs of the things. And then this is the one which is not washed properly. So you have to do like this, right? Like this. And so on. So you have to wash up to here and then don't touch anything. So it's very, very important to know that and practice that all the time, okay?
Jahon sog'liqni saqlash tashkiloti bo'yicha qo'lni yuvishni 5 ta qadami mavjud. Siz qo'lingizni birinchi old qavatlarini yuvasiz, keyin qo'lingizni oldi barmoqlarini, tirnoq sohalarini yuvishingiz kerak va juda muhim bosh barmoqlaringizni yuvishingiz juda muhim. Bu demak ko'p vrachlar tomonidan demak amalga oshirilmaydi va shuni bilishingiz kerakki, qo'lingizni tirsak sohasigacha yuvishingiz juda muhim hisoblanadi va qo'lingizni yuvib bo'lganingizdan keyin hech qanday sohani, hech qaysi joyni ushlashingiz mumkin emas.
Sometimes it's not working. Oh, now it's working. Yeah. So,
because it's connected to
right, okay.
So people in my camera are also watching.
See that. Okay, no problem. So then we have, I told you there are 5 things. One is hand wash, personal protective equipment. And these are proper wearing of surgical masks, using face shields. Okay, there is a thing called the fit testing for the face mask, and then different types of respirators you can use, and then also the protective gowns.
Keyingi maxsus himoya qiluvchi vositalar. Demak, biz yuqorida aytib o'tdik, patogen mikroorganizmlarni saqlashning 5 ta yo'li bor. Bu demak ikkinchi yo'l hisoblanadi. Demak, maxsus himoyalovchi vositalarga demak maxsus maskalar kiradi, demak respiratorlar, maxsus demak kiyimlar va maxsus demak himoya qiluvchi vositalar buni misol bo'lishi mumkin.
So I don't have time to go through all this in detail because it will take the whole day. So I am taking only very important areas.
Men hammasi bilan birma-bir aytib o'tirmayman, chunki kechgacha bu haqida gapirishimiz mumkin. Men juda muhim qismlarini demak sizlarga aytib o'tiraman.
So the most common way you get infection in dentistry is through the nose. So the respiratory protection is, everything is important, but this is the most important. Okay.
O'zi hamma narsa juda muhim, lekin yanada muhimroq narsa bu patogen mikroorganizmlarni havodan yuqishi juda muhim hisoblanadi. Shuning uchun biz demak respiratorning shu maxsus himoyalovchi vositalardan foydalanishimiz muhim hisoblanadi. Ya'ni shu maskalar haqida gap ketmoqda.
So you have to have the respiratory protection, you know, like if you, like for example, if you have the mask and then you have face shield for every patient, that means you are wasting resources. So you have to prepare your respiratory protection according to the type of the patient.
Yana juda muhim qismi, siz agarda har bitta kelgan bemorga maska va himoyalovchi vositadan foydalanadigan bo'lsangiz, siz klinikani resurslarini behuda sarflayotgan bo'lishingiz mumkin. Siz shuni bilishingiz kerakki, har bir bemor uchun siz individual podxod qilishingiz kerak bo'ladi. Ya'niki har doim ham shu klinikani resurslaridan oqilona foydalanishingiz muhim hisoblanadi.
Right, so we are going to jump from the respiratory infection to another important area you may not realize. In dentistry, with the machines, we have a lot of dental unit water lines. In the water lines, there are bacteria collecting fungi and viruses. They are called biofilms. You can see a water line and see all the biofilms, right? And these can contaminate your patients and cause infection.
Stomatologiya klinikani yana bir muhim jihati bu o'sha kanalizatsiya va kiruvchi va chiquvchi suvlarni demak tozaligi. Demak, patogen mikroorganizmlar o'sha trubalar orqali, kanalizatsiya trubalari orqali demak sizni klinikingizga kirishi va o'sha patogen mikroorganizmlarni tarqalishiga demak sabab bo'lishi mumkin.
Yeah, now you might think that the water line has to be totally sterile, zero bacteria. No, it's not the case. You are allowed to have so-called saprophytic organisms, up to 500 colony forming units per milliliter.
Endi hozir siz shuni o'ylab qolishingiz mumkinki, demak kiruvchi va chiquvchi o'sha kanalizatsiya va trubalarda demak patogen mikroorganizmlarni o'sha konsentratsiyasi 0 ga teng bo'lishi kerak deb o'ylashingiz mumkin. Lekin aslida unday emas. Patogen mikroorganizmlarni o'rtacha me'yor mavjud. Me'yor 500 o'sha CFU dan oshmasligi kerak bo'ladi, shu standart bo'yicha.
So, in order to control the waterline biofilm growth, there are so many different mechanisms. Again, it's very big area. For example, you give intermittent shock treatment like intermittent disinfections, and then also routine monitoring is important.
Patogen mikroorganizmlarni shu quvurlarda nazorat qilish uchun juda ham ko'plab yo'llar mavjud. Shulardan biri o'sha shok protokoli yoki o'sha quvurlarni maxsus dezinfektant vositalari bilan dezinfeksiya qilish hisoblanadi.
Right. So next we go on to the aerosol area, aerosol control area. Okay. So number of things you have to do in your clinic, and it's here. You have to have high volume evacuation, right? Very good extraoral suction, and then you have rubber dam isolation and four-handed rinsers and pre-procedural dentistry. So these are important areas to control aerosols.
Demak, aerozolda patogen mikroorganizmlarni nazorat qilish qanday amalga oshiriladi? Birinchisi, klinikangizda sizda yuqori bosim bilan tortuvchi vitishkada joylashtirilgan bo'lishi kerak. Undan tashqari sizlar izolyatsiya bilan ishlashingiz kerak va 4 ta qo'lda ishlashingiz kerak assistent bilan. Undan tashqari siz demak maxsus himoya qiluvchi vositalardan foydalanishingiz kerak va o'sha demak suctionlar, so'zlardan demak foydalanishingiz kerak bo'ladi.
So if you want to have good aerosol control, you want to have good ventilation, like good air conditioning and so on. And for the air conditioners, you need to have special filters which are purified, which are checked all the time, and then they say that the air in the room should be changed at least 6 times every hour for a good circulation.
Demak, klinikada patogen mikroorganizmlarni nazorat qilishni juda muhim qismi bu ventilyatsiya qilish hisoblanadi. Demak, yuqorida biz aytib o'tdik, shu ventilyatsiya qilishimiz ham demak maxsus yuqori bosimda tortuvchi ventilyatsion tizimlar orqali amalga oshirilishi kerak va ventilyatsion tizimlar maxsus filtrlar yordamida doimiy ravishda demak nazorat qilib turilishi kerak bo'ladi.
Yeah, so now coming to another important area, which is disinfecting the surfaces, because when you are using the high splatter, high volume 3D 3-in-1 syringes and so on, it creates a lot of bubbles and a lot of droplets. They land on surfaces, right? And these have to be cleaned, and these are the different types of cleaning techniques.
Keyingisi demak dezinfeksiya qilish hisoblanadi. Agarda siz stomatologiyada maxsus demak o'sha spreylar yoki maxsus dori vositalaridan foydalanadigan bo'lsangiz, ushbu dori vositalari demak o'sha stolga boshqa buyumlarga tushgan holatda demak patogen mikroorganizmlarni o'ziga jalb qilish xususiyatiga ega. Demak ushbu holatda patogen mikroorganizmlar dezinfeksiya yo'li bilan demak olingan bo'lishi muhim hisoblanadi.
So again there are a lot of techniques used for that, and now they say it's better to have spray disinfectants rather than wiping.
Juda ham ko'plab vositalar mavjud dezinfeksiya qilish uchun. Hozirgi ilmiy adabiyotlar shuni ko'rsatadiki, spreylar demak o'sha maxsus o'sha lattalarga nisbatan yaxshiroq foyda berishi ko'rsatilgan.
Right, so another important area, I told you there are 5 areas, we are coming to the last one, is how to process the instruments that are used on the patients.
Keyingi demak soha bu instrumentlarni qanaqa qilib tozaligini saqlab qolish hisoblanadi. Bu juda muhim yo'nalish hisoblanadi.
So there is a thing called the Spalding classification, right? And that is divides the instruments into 3 categories: critical items, semi-critical items and non-critical items.
Spalding tomonidan maxsus ishlab chiqilgan demak klassifikatsiya mavjud. Barcha vositalar 3 ta demak klassifikatsiyaga bo'linishi kerak bo'ladi. Birinchisi kritik bo'lgan vositalar, ikkinchisi o'rtacha kritik darajadagi vositalar va uchinchisi kritik bo'lmagan vositalar hisoblanadi.
So the critical items are the ones which breach the mucosa or the skin, and the semi-critical items are the ones like the mirror and the probe, which don't breach the mucosa. And non-critical items are things like the surfaces and similar areas.
Kritik vositalarga nima kiradi deb aytadigan bo'lsak, kritik vositalar bu og'iz bo'shlig'i bilan to'g'ridan-to'g'ri kontaktda bo'lgan demak vositalar hisoblanadi. Ular qon va so'lak bilan to'g'ridan-to'g'ri kontaktda bo'ladi. Keyingisi bu o'rta kritik bo'lgan vositalar. O'rta kritik bo'lgan vositalar bu masalan stomatologik o'sha zerkal deb aytamiz, ya'ni so'lak bilan to'g'ridan-to'g'ri kontaktda bo'lgan demak vositalar. Va keyingisi kritik bo'lmagan dori vositalar. Ular so'lak bilan yoki qon bilan to'g'ridan-to'g'ri kontaktda bo'lmaydi.
So again there are a number of steps, I don't have time to go in, but you have to read, you have to wash them, you have to clean them, then you have to put them into a sterilizer.
Demak, har biri bo'yicha men chuqurlashib o'tirmayman. Demak, umumiy qilib aytadigan bo'lsak, instrumentlarni sterilizatsiya qilish juda muhim hisoblanadi. Birinchi bo'lib siz dezinfeksiya qilishingiz kerak, o'sha maxsus ultrazvuklar yordamida tozalashingiz kerak va probalar qo'ygan holatda uni sterilizatsiya qilishingiz kerak bo'ladi.
Yeah, so sterilization have different technologies, different types of autoclaves, and this is used by both medicine and dentistry and all the surgical areas. And again, you will have to use sterilizers with different types of indicators to show that the sterilization of your load has taken place.
Sterilizatsiya qilishni har xil yo'llari mavjud, har xil brendlari mavjud, har xil kompaniyalar tomonidan o'sha sterilizatorlar ishlab chiqarilmoqda, lekin juda muhim hisoblanadi sterilizatsiyani sifatini nazorat qilish.
Yeah, so you can't just put your load into the sterilizer, take it out and just leave it. No, you have to monitor the sterilization. And monitor means whether that load has been reached a specific temperature, like 134 degrees for 4 minutes and so on and so forth, right? So for that, there are different types of indicators: mechanical, chemical, biological, and digital documentation and audit register. These are the 4 areas.
Siz instrumentni oddiygina qo'yib sterilizatsiyaga jo'natishingiz noto'g'ri bo'ladi. Nima uchun? Sababi sterilizatorni qanchalik to'g'ri ishlayotganini nazorat qilish ham juda muhim hisoblanadi. Endi sterilizatsiyani to'g'ri ishlayotganini nazorat qilish uchun har xil probalar mavjud. Demak, shu probalar mexanik probalar, kimyoviy proba yoki biologik proba bo'lishi mumkin yoki maxsus o'sha raqamli texnologiyalardan foydalangan holatda ishlatiladigan probalar demak mavjud.
So this is very important because like UK, US now, there are inspectors, infection control inspectors. They come and look at your sterilization documentation. So everything has to be documented. How many, all the tests you did and how many times you did and everything. So again, regulatory oversight is very important.
Bu juda muhim hisoblanadi. Masalan, Amerika yoki Angliya mamlakatlarida maxsus inspektorlar bor. Ular klinikaga bexosdan kelgan holatda o'sha sterilizatsiyani, nazoratini tekshirishlari mumkin bo'ladi. Demak, barcha instrumentlarimiz hujjatda ko'rsatilgan bo'lishi juda muhim hisoblanadi.
Yeah, so now we are finished with all the different core areas of infection control. So I'm going to talk to you about some of the new things which are happening and some of the things which is going to happen in the future. Now, one of the most important things which we are now considering is called the green dentistry movement. That means we have to ensure that whatever we use is necessary and not redundant, not unnecessary. Like for example, you are wearing a mask, then the face shield. You are wearing 2 or 3 overlayers of gowns, and then you are using too many disinfectants. And this is not very good for the environment, not good for you, and cause various issues. So green dentistry is a very important area.
Endi umumiy qilib aytadigan bo'lsak, hozir infeksion kontrol bo'yicha umumiy ma'lumotni men berib o'tdim. Hozirda rivojlanib kelayotgan soha bu yashil stomatologiya hisoblanadi. Yashil stomatologiya bu nima degani? Siz har doim bilishingiz kerakki, siz infeksiyani nazorat qilish uchun turli xil vositalardan ko'plab foydalanmoqdasiz. Ya'ni maska bo'ladimi yoki maxsus himoyalovchi vositalar bo'ladimi? Lekin siz shuni o'ylashingiz kerakki, ushbu vositalardan foydalanganingizdan keyin ushbu vositani qayta ishlash qanday amalga oshiriladi? Ya'ni siz uni prosta tashlab olmaysiz, bu musor emas, balki uni qayta ishlash qanday amalga oshiriladi? Mana shu yashil stomatologiya hisoblanadi.
Yeah, so I'm kind of skipping some, okay, just want to, yeah, so another area is that when you are using in the dental clinic, lots of sharps like scalpels, needles, probes. So it's very, very common particularly for dental students to get sharps injuries. So this is very, very important, and there are so many devices to prevent sharps injury, and you have to be aware of that.
Stomatologiyada sizlar juda ham ko'plab, demak, o'tkir tig'li vositalardan foydalanasizlar. Bu skalpel bo'lishi mumkin, shprits yoki igna, boshqa vositalar bo'lishi mumkin. Lekin siz buni, demak, nazorat qilishingiz kerak bo'ladi. Ayniqsa birinchi kurs yoki boshqa, demak, talaba bo'ladigan bo'lsa, ular demak, ushbu vositalar yordamida qo'llariga kirib ketishi mumkin yoki boshqa holat bo'lishi mumkin. Siz bunda ehtiyot bo'lishingiz kerak bo'ladi.
So I just want to speak to you about what will happen that once you get a sharps injury. And before I do that, I just want to talk a little bit about vaccinations. There are so many different vaccines dentists and doctors have to take to prevent infection. So please be aware that there are lists of vaccines which are important in the CDC, so you have to be aware of that.
Hozirda demak o'tkir tig'li vositalarni, demak o'tkir tig'li vositalar yordamida yuqadigan patogen mikroorganizmlarni to'xtatib qolish uchun turli xil vaksinalar mavjud. Demak, doktorlar, xususan stomatologlar ham ushbu vaksinatsiya jarayonidan muntazam ravishda o'tishgan bo'lishligi kerak bo'ladi.
So now let's talk about what happens if you get a sharps injury. There are a number of steps you have to do for you or for your patient, and these are shown here.
Agarda bexosdan, demak, o'sha o'tkir tig'li vositalar qo'lingizga kirib ketsa, nima qilish kerak? Siz va bemor.
So the first thing is you have to wash your injury immediately under a tap of running water for about at least 1 to 2 minutes.
Birinchisi, zudlik bilan siz qo'lingizni yuvishingiz kerak bo'ladi 2-3 minut davomida.
And then you have to report it to the regulators and make sure that the patient or with the sharp injury does not have hepatitis B, hepatitis C or HIV and all the other blood-borne infections.
qo'lingizga kirib ketgandan keyin instrument buni hujjatlashtirishimiz, ya'ni rasmiylashtirishimiz juda muhim hisoblanadi va yana bir muhim jihati siz o'zingizda yoki bemorda yuqumli kasalliklar mavjud emasligini ishonch komil qilishingiz kerak. Masalan, gepatit, spid yoki boshqa kasalliklar bo'lmasligini siz ko'rishingiz kerak.
And once again, you have to write it down. Documentation is very critical because the patient can sue you later. You will spend, sometimes if you are found to be guilty, they will take away your dental license, regulatory authorities. So these are very important matters. So keeping a logbook of injuries, what you did with the patient, what you did with yourself, why did you report it? The patient can always complain to the authorities.
O'tkirtirli vositalar sizga yoki bemoringizga bexosdan kirib ketadigan bo'lsa, buni rasmiylashtirib qo'yish juda muhim hisoblanadi. Nima uchun? Sababi juda ham ko'plab holatlar yuzaga keladi. Qachonki bemor doktor tomonidan sudlashadi va ushbu sudda bemor albatta yutib chiqadi. Va agarda bemor yutib chiqadigan bo'lsa, sizni o'sha stomatologik litsenziyangizdan mahrum qilishi ham mumkin.
So another area, I'm going to jumping from one area to another. Now a new thing again, which was came after last 10 years or so, is digital dentistry and artificial intelligence and all that. So because of that digital dentistry, we have new instruments and new things coming into the clinic, such as sensors and 3D printers and CAD/CAM and all these things. So for all these, the new equipment has to be properly disinfected and cleaned. Otherwise, if you put it in the sterilizer, you will destroy your, $1,000 sensor. You have to be very careful.
Keyingi oxirgi 10 yilda juda ham rivojlanib kelayotgan soha bu demak raqamli stomatologiya va sun'iy intellekt hisoblanadi. Demak, siz shuni bilishingiz kerakki, ushbu vositalardan, ya'ni o'sha sensorlar ishlatasizlarmi yoki 3D printer yoki boshqa vositalardan foydalanasizlarmi, uni qanday qilib infeksiyani qanday qilib nazorat qilish kerakligini bilishingiz juda muhim hisoblanadi. Nima uchun? Sababi masalan siz agar sizda sensorni sterilizatsiya qilmoqchi bo'lsangiz, avtoklav yoki boshqa vositaga joylashtiradigan bo'lsangiz, sizni sensoringiz buzilib qolishi mumkin yoki boshqa holatlari uchrashi mumkin.
So another area I'm going to jump into is teledentistry. So you might be thinking, what is the connection between teledentistry and infection control? The connection is that if you prevent patients coming to your clinic, that means it's easy for the patient, yes. Also, if the patient is having some infection, then he or she will not bring the infection to your clinic. Okay?
Keyingi rivojlanayotgan soha bu telestomatologiya hisoblanadi. Endi siz hozirda o'ylashingiz mumkin, telestomatologiya va og'iz bo'shlig'idagi o'sha infeksion kontrolni bog'liqligi qanday? Agarda siz bemorni klinikaga kelmasligini ta'minlab, bemorga davo choralarini ko'radigan bo'lsangiz, siz klinikangizga olib kelinishi mumkin bo'lgan patogen mikroorganizmlarni to'xtatib qolgan hisoblanasiz.
So you can do the triaging virtually, you can do the teledentistry, you can follow up patients remotely, you can ask them to show the wound, or they don't have to come to the clinic, and that reduces exposure, reduces their expenses, and also reduces the burden number of patients for you to have, right?
Demak, siz telestomatologiya yordamida virtual ravishda bemorni konsultatsiya qilishingiz mumkin, davo choralarini amalga oshirishingiz mumkin va demak samarali ravishda bemorga o'sha vaqtlarini qo'yib berishingiz mumkin va bunda bemorni klinikaga kelishini saqlab qolgan bo'lasiz.
Again, I am jumping into another area which is called good antimicrobial prescribing, right? Do you know that what percentage of antibiotics prescribed by dentists all over the world?
Keyingisi bu antimikrob vositalardan demak foydalanish hisoblanadi. Sizlar bilasizlarmi, stomatologlar tomonidan qancha antimikrob vositalardan demak foydalanadi?
Anybody? 20%, 40%, 50%, 10%? 80%. No. For dentists, about 15 to 20% of the antibiotics are prescribed by dentists all over the world. So the reason is that if you abuse antibiotics, if you give for every infection, like sometimes, this is a very controversial area about third molar surgery. After third molar surgery, without any issues, you give antibiotics, very common. Or sometimes the patients want antibiotics, you give it to them. So that is antibiotic abuse.
Barcha antibiotik vositalarni 10-15% stomatologlar tomonidan hozirda demak foydalanadi. Demak, stomatologlar tomonidan antibiotiklarni demak haddan tashqari ko'p foydalanish demak holatlari duch kelmoqda. Masalan, deylik 3-malyar tishni olinayotganda antibiotik beriladimi, yo'qmi? Ba'zida demak bemorlarning o'zi antibiotik ichishni xohlashadi.
So there are various ways to do it. Like for example, 20 years ago, for every heart patient we used to give antibiotics with a person with a heart history. But no, now it's all new regulations, we don't do that. So you have to be aware of the antibiotic prescribing practices for dentists so that you do not abuse antibiotics. For example, do you know that if you get infection with a specific staphylococcus called vancomycin resistant staph aureus, that for this organism there is no antibiotic now, everything is resistant. So we are running out of antibiotics and we have to be very careful about antibiotic use to prevent infections.
Oldinlari biz har qanaqa kasalliklar bo'ladigan bo'lsa, biz bemorga birinchi bo'lib antibiotik yordamida demak davo amaliyotlarini amalga oshirar edik. Lekin hozirgi zamonaviy protokollar shuni ko'rsatadiki, har doim ham antibiotikni juda ham ko'plab miqdorda berish mumkin emas. Sizlar bilasizlarmi, maxsus patogen mikroorganizm shtampi bor. Ushbu shtamp hech qaysi antibiotik vositasiga resistent hisoblanadi. Ya'ni har qanaqa antibiotik beradigan bo'lsangiz ham ushbu antibiotik ushbu patogen mikroorganizm o'lmaydi.
So infection control is a very expensive business. If you are in private practice, they say 10 to 15% of the cost for each patient now is related to infection control. So if you do improper infection control, that means you are spending your money and patients' money unnecessarily. So you have to be very, very careful in choosing your patients. So the patients with regard to different infection control levels have been divided into highest risk, high risk, moderate risk and standard precautions. 95% of these patients are the standard precautions you have to use, right? For the other guys, you have to use special precautions like additional mask and so on and so forth. Okay?
Sizlar bilasizlarmi, infeksiyani nazorat qilish sohasi bu juda katta biznes hisoblanadi. Har bir bemordan to'layotgan demak o'sha mablag'idan 10-15% infeksiyani nazorat qilishiga demak odatda yo'naltiriladi. Agarda siz hamma bemor uchun bir xil infeksion protokol bilan ishlaydigan bo'lsangiz, siz klinikani resurslaridan noqonuniy foydalanayotgan bo'lasiz. Endi siz bemorlarni to'g'ri tanlashingiz juda muhim hisoblanadi. Ya'ni siz bemorlarni juda ham yuqori riskga ega, o'rta riskga ega va riski darajasi kamroq bo'lgan demak bemorlarga ajratishingiz muhim hisoblanadi.
So for example, if you take category the highest risk, there are because of the new developments in medicine and dentistry, people are living for a long time. They are immunocompromised, they could be transplant patients, chemotherapy patients, and so on and so forth. So for these patients, if they come to your clinic, you have to have special precautions. So that's the point I'm trying to tell you.
Masalan, agarda bemor yuqori riskli bemor bo'ladigan bo'lsa, bu qanday bemor? Masalan, kimyoterapiya olayotgan bemor yoki transplantatsiyadan kelgan bemor yokida spid bilan kasallangan bemor, ularni biz yuqori risk guruhiga demak kiritishimiz mumkin bo'ladi. Va ushbu bemorlar sizni klinikangizga keladigan bo'lsa, siz juda ham demak ehtiyotkorona ishlashingiz kerak bo'ladi ushbu bemorlarda.
So we are coming to the last few slides of your presentation. It's a very kind of short presentation, but I can speak the whole day on this, just giving the main points. And so what about the future? So we have to learn lessons from our COVID-19 exposure in 2020 and 2021 and so on. You remember how we for months we were inside and we had a lot of issues. So there are new, as I said at the very beginning, there are emerging and re-emerging pathogens, and the next one they say is bird flu, but we really don't know. So we have to be prepared for these infections. And one of the latest things they are saying that hopefully it will not happen is using drone technology to spread nasty pathogens, which are newly described viruses, which are very really. So you have this biological wars, which because of the drones they can send everywhere in the world. So the point is you have to be prepared for new and emerging pathogens.
Demek kelajakda bizni nima kutmoqda? Demak COVID-19 bizni juda ham ko'p narsaga o'rgatdi. Hozirda yangi texnologiyalarning rivojlanishi, ya'ni masalan dronlarning rivojlanishi yangi o'sha davlatlar o'rtasidagi nizolarga olib kelishi mumkin. Ya'ni davlat tomonidan patogen mikroorganizmni shtampi ishlab chiqariladigan bo'lsa yoki viruslar ishlab chiqariladigan bo'lsa, hozirda ular o'sha texnologiyalar yordamida, xususan dronlar yordamida yuqori tezlikda osonlik bilan boshqa davlatga yetkazilishi mumkin. Bu biologik o'sha urushga sabab bo'lishi mumkin kelajakda.
Yeah, so the bottom line here is, so we have to have quality assurance in infection control in every clinic. If you have 2 or 3 nurses, you have to have one person designated as an infection control coordinator. We need to have standard operating procedures for infection control. We have to do routine audits, incident reporting, and so this virtuous cycle goes on.
Demak, infeksiya qilishni, nazoratni oshirish juda muhim hisoblanadi. Masalan, siz klinikangizda 2 ta yoki 3 ta medsestraingiz bo'lsa, bitta o'sha kichik tibbiyot xodimingiz, demak, albatta infeksiyani nazorat qilishga yo'naltirilgan bo'lishi kerak. Undan tashqari ularni demak har doim o'qitib borish va ularni koordinatsiya qilish va maxsus protokollarni doimiy ravishda ishlab chiqish juda muhim hisoblanadi.
Yeah, so another area just very quickly I want to touch is you have to inform the patients about importance of infection control. So when you see nice infection control measures in your clinic, then patient will like to come and see, you know, this doctor is using very good infection control, and therefore they like to come. So it's a practice building measure. Then also you will have to tell the patient, if they go and ask for antibiotics, can you give antibiotic for my tooth pain or something? You have to tell them why we can't give, because you have to explain the reasons. So patient education is part and parcel of infection control.
Keyingi juda muhim soha bu bemorlar bilan muloqot qilishni oshirib borish hisoblanadi. Masalan, bemorlar sizdan so'rashi mumkin, agarda tishim og'riyapti, menga antibiotik bera olasizmi? Siz bunga yo'q deb javob berishingiz kerak bo'ladi, yoki agarda siz to'g'ri muloqotni shakllantirsangiz bemor bilan, ushbu bemoringiz yana klinikingizga qaytib kelish ehtimolligi oshadi.
Yeah, so what's the future? So there's going to be lots of changes in the future in terms of, for example, we might have smart sterilizers where you don't have to do the regular monitoring. It's connected to the internet and it will tell you automatically onto your laptop your functionality of your autoclave, for example.
Demak, kelajakda nima bo'lishi mumkin? Hozirda maxsus texnologiyalarning rivojlanishi orqali biz infeksiya nazoratini to'g'ri yo'lga qo'yishimiz mumkin bo'ladi. Masalan, maxsus robotlar yoki maxsus sensorlar yordamida o'sha sterilizatorimiz yoki boshqa vositamiz to'g'ri ishlayotgani yoki to'g'ri ishlamayotganligini biz nazorat qilish imkoniyatiga ega bo'lamiz.
So, you know, I live in Hong Kong, so in China, Hong Kong, we use a lot of robots. So robotics coming into even to dentistry now. We have robotic implants and so on. Robots doing implants. So there are some few clinics in China using robots for disinfection surfaces. So at the end of the clinic, the robot comes in and cleans the surface. So this is the future of dentistry. It will come in because you don't have to pay the DSA or you save money.
Men o'zim Gonkongda yashayman. Xitoyda va Gonkongda hozirda juda ham ko'plab robot xizmatlaridan foydalanib kelinmoqda. Xususan stomatologiyada ham ko'plab robotlar ishlatilmoqda. Bunga misol tariqasida biz implant qo'yuvchi robotlarni aytishimiz mumkin yoki maxsus dezinfeksiya qiladigan robotlar ham hozirda juda keng tarqalmoqda. Ushbu robotlar yordamida biz dezinfeksiya amaliyotini oddiygina amalga oshirishimiz mumkin va juda muhim juda muhim qismi bu ushbu robotlarga siz pul to'lashingiz ham shart emas.
So they are having lots of new surfaces like this with antimicrobial coating. So there's a lot of bacteria will not survive. And so new developments are coming into the future. Okay.
Undan tashqari yangi materiallar, yangi vositalar paydo bo'lib kelmoqda. Ushbu vositalarga patogen mikroorganizmlarga tushadigan bo'lsa, ular bu yerda tirik qoladi.
Yeah, so what are the key take-home messages? So as I mentioned at the very beginning, infection control is not something you just study and just forget about it. It has to be a part and parcel for your work ethic on a daily basis. Okay, that's very, very important. So you got to know all the principles of infection control, and you know whether there's a new infection or an old infection, then you are prepared for the infection control.
Infeksion kontrol, shuni bilishingiz kerak, infeksion kontrol bu juda muhim soha hisoblanadi va infeksion kontrol bu xuddi yangi fanni boshladingiz va buni tugatdingiz, bo'ldi, esdan chiqib ketdi degan narsa emas. Infeksion kontrol bu sizni shu umringiz davomida foydalanishingiz kerak bo'lgan muhim soha hisoblanadi.
So it is also very evolving. It changes every day. You might get a new infection. The CDC may declare something new. So the old regulations will go out of the window and so on. So it's a very dynamic situation. You have to be totally aware of it, and you have to be continuously educated about it. And seminars like these for the students and practitioners are very, very important for proper infection control. And last but not the least, the guidelines and regulations. I know it's not prevalent in Uzbekistan, but UK, US and various other places, they have inspect the infection control, and if you don't abide by the rules, they take you to the court, or they ask you to stop the practice for 1 to 2 months until you show them that you are now compliant with the regulations.
Ushbu soha juda dinamik soha hisoblanadi va bu nima bilan bog'liq? Bu patogen mikroorganizmlarni o'zgaruvchanligi bilan bog'liq. Ya'ni patogen mikroorganizmlar vaqt o'tgandan keyin ular evolyutsion nuqtai nazardan o'zgarish qobiliyatiga ega hisoblanadi va biz ishlab chiqargan bugungi protokollarimiz ertaga уже kerak bo'lmay qolishi mumkin. Shuning uchun doimiy ravishda patogen mikroorganizmlarni o'rganib borish, ularni eliminatsiya qilish yo'llarini o'rganib borish bo'yicha protokollar ishlab chiqarish juda muhim hisoblanadi. Undan tashqari, masalan Amerika yoki boshqa davlatlarda maxsus inspektorlar mavjud. Siz protokolni to'liq shu protokolda yozilgan bo'yicha hamma ishlarni amalga oshirmoqdamisiz yoki yo'qmi, ularni nazorat qilib yuruvchi maxsus inspektorlar mavjud. Agarda siz qaysidir qismini qilmaydigan bo'lsangiz, bu protokolda yozilgan, siz sudga borishingiz mumkin bo'ladi.
Yeah, so with these remarks, I just want to thank your rector for my invitation and also for you listening for 1 hour. Before I finish, I want to ask you, have you, you are first year students, have you thought about this subject at all?
Shu bilan birga meni taklif qilganingiz uchun professor Lakshmanga va studentlarga katta rahmat deb aytmoqchiman. Undan tashqari men shunday savol bermoqchiman, ushbu soha bilan siz qanday tanishsiz? Ya'ni shu sohani siz oldin bilganmidingiz?
Can you put the hands up if you have heard about this subject?
Shu sohani bilarmidinglar oldin?
Yeah.
No, first year students.
Yeah, I know, but sometimes they hear from the papers and newspapers and so on and so forth. Yeah, so I hope you got a first good lecture on infection control, but I can assure you this won't be the last lecture in your career, because it's really very important.
Bu juda muhim soha hisoblanadi. Men o'ylaymanki, kelajakda sizlar yana ko'proq ushbu soha bo'yicha bilimlaringizni, demak, oshirasiz. Katta rahmat.
Okay, thank you very much.